Now, some patients say that they're washing during their normal hygiene. They're showering in the morning, they're washing, and they get a cut. They get a cut just from scrubbing with your sponge or scrubbing with their wash towel. And they're like, the skin there is so fragile. The skin there is so thin. Any activity there causes bleeding or lacerations or cuts. The other thing is they notice it most during sexual activity. They don't have as much lubrication. It makes sex uncomfortable. And part of the things that gets a woman ready for sexual activity is actually desire. And so if their desire is gone, they don't lubricate, and then the vaginal environment doesn't even have the glands to produce the lubrication, and so sex is uncomfortable. Yeah. Another sign of vaginal dryness is overactive bladder. So people have already gone to urologists. They've already been tested by their PCP for urinary tract infections, and there's no infections whatsoever. They just always have an urgency to pee. That's an evidence of vaginal dryness. Some people say, I have no issues during sex, but I'm always feeling like I gotta pee. There's vaginal dryness there. The other thing is recurrent vaginal infections. People say all the time, there's this discharge and there's this odor. And every time we're treating them for BV, they're like, why does the BV not go away? Vaginal dryness. All those things are what estrogen used to protect us against. So estrogen gives you lubrication, gives you bladder control, gives you pH balance. But when you lose your estrogen and the vagina becomes dry, those are the things you start experiencing. And so those are the telltale signs that there's vaginal dryness going on. Going to what we do about it. When I counsel my patients, I tell them there are 3 tiers, right? There is the low tier, there's the middle tier, and there's the high level tier. So the highest level of care. The reason for the dryness is loss of lubrication. And so we say you can use a moisturizer to lubricate the vagina. Those are over the counter. I'm sure you've heard of Replens, Refresh. There are some of these oils. There's a lady online that sells Chinese medicine compounded into an oil, into a tablet that then dissolves in the vagina. So those are lubricants. They can help with the lubrication part, but they don't give the vagina estrogen. They don't help to balance your pH that much, but they will help with the initial discomfort. Those are the things you can do for yourself. So if it's dry, they think it needs moisture, vaginal moisturizers are an option. The middle tier is vaginal estrogen. The root cause of the dryness is loss of estrogen. Loss of estrogen because you're breastfeeding, loss of estrogen because you're in menopause, loss of estrogen just because you're getting older. And so the vagina starts to react to that. So we can give vaginal estrogen. And that has been shown to be safe, even for patients with breast cancer. New evidence shows that we can actually prescribe that. We used to shy away from it, for women with breast cancer. And my hands were always tied, like I have nothing to offer this woman, And
after battling breast cancer.
I know. And then surviving that and now having to suffer the estrogen deficiency because of that. And so vaginal estrogen is good. It helps. It's usually twice a week. Initial treatment will be every day for 2 weeks and then twice a week after that. But it's something you have to keep doing every week over and over again. You have to keep applying.
And these are like pastries, pastries, vaginal pastries?
Suppositories, correct, suppositories. So the vaginal estrogen can come in the form of a pill. So you put a pill inside the vagina, or it can come in the form of a ring. And you just put the ring in the vagina and it can stay there for 3 months. And then there's the cream. So the pill and the cream will be the twice a week insertions inside the vagina. And those are to help keep the vagina, giving it the estrogen it needs, helping to balance the pH, helping to reduce the irritation that the bladder gets from the vagina being dry. That's middle tier. I have people who don't do well with it. They either they don't like the cream coming back out later, or the pill is too expensive, their insurance wouldn't cover it. So there are a lot of caveats, a lot of reasons why people might not be able to get access to vaginal estrogen. Now, my top tier one, which I actually went in search for because of patients I couldn't help. Patients, I'm like, I have no tools whatsoever. They do not want estrogen. Even after counseling them that it's safe for breast cancer patients, they're like, I don't want to touch it. I don't want to risk it. And so I was like, what can I do for this woman? And then I found vaginal laser therapy.
Okay.
I'm telling you, it's even for me being the person doing it for the patients, I'm as transformed.
Really?
It is. So it's when we use it's like a vaginal probe. It looks like an ultrasound probe.
Okay.
I insert it in the vagina, and there's a foot pedal that comes with it. And I press the foot pedal, and it delivers laser energy to the vagina.
Okay.
I turn that 360 degrees, I turn it 360 degrees, laser, another turn, laser, another turn, laser. There are like markers on there that tells you that you've made a full turn. And then you remove the probe like 1 centimeter, turn it again, full turn, 1 centimeter until you've treated the whole vaginal canal. And it takes like 5 minutes to do. And
wow.
Yeah, literally within 5 minutes, you do 1 pass, 2 passes, they're done. And then that's every month for 3 months. So 1 treatment monthly for 3 months. So 3 treatments, and that's it.
Question.
Yes.
Is this thing painful?
Not at all. It is not painful. There's a patient of mine who came to me for urinary urgency, or what we call urgent incontinence. So she's in a meeting and she has to literally jet out of the meeting to go to the bathroom, because if she tries to hold her urine, she's going to have an accident. No. So once she feels the urge to pee, she has to go immediately, otherwise she'll pee on herself. And so it become embarrassing for her, because she'll have to interrupt the conversation and rush to the bathroom. Yeah. I said, let's try this laser thing. I gave her, she had 1 treatment of the laser, and a week or 2 later, I was following up with her, and she said that she can hold her urine better. And then after the 2nd treatment, she doesn't have the urgency anymore. She said, you gave me my life back. You gave me, I feel normal. I feel like a normal person again. I can hold my urine until I'm ready to go to the bathroom. Nobody has to know that I gotta pee.